In the name of the Schulthess Klinik, I would like to welcome you to our patient event this evening about the present and the future of joint implants.
The computer simulation plays a very important role in the development and improvement of hip implants because it allows us in a very short period of time to test a variety of combinations of implant type and also patient characteristics like the size, weight, and activity level of patients. It's important for us also that the individual characteristics of patients can be inserted into the models so that rather than studying one single ideal patient, we're looking at the performance of the implant across a whole population.
We tested hip replacement patients for muscle strength and asked patients with unilateral hip osteoarthritis if they would like to take part in the study with the general goal to increase the longevity of hip implants. We tested hip, knee, and ankle muscle strength of our patients using a strength measurement device. We also measured functional tasks such as standing up from a chair, walking, or climbing stairs. The data will be implemented in the virtual patient computer model, which is managed by the ETH Zurich and Antibody Technology. The strength data from actual patients will allow to obtain more realistic results about joint contact pressures calculated by this computer model.
The important aspect of the data that was collected in the Schulthess Klinik is it complements the data that was collected in Leeds by adding important information about the activity level and strength of muscles before and after hip surgery. This is a specialty of the lab in the Schulthess Klinik, and it's allowed us to find out very important things about muscle weakening prior to surgery, the influence of surgery on this asymmetry between the operated and unoperated leg, and also the recovery phase of the patient. This then determines overall the loading of the joint.
I think what's very important is that they should be able to last longer. I understand that the average lifespan of a joint at the moment is 15 years. Some people are lucky and it lasts longer, but it would be nice if that could be guaranteed under normal circumstances.
We have been analyzing about 250 explanted components from patients, either components which have failed in the patient and had to be revised, or components which were retrieved during autopsy after somebody has died. The interesting thing we found is that about 15 years ago, most of the components which failed had really a structural failure. What's happening now is that the interface between the implant and the bone is actually failing. And that gives us the challenge that we have to try to develop implants where we can make sure that the interfaces of the implant are more robust. That means that they tolerate more differences in the way how we put it together or in the way how we load it in the patient afterwards. We still have the occasional situation where an implant does not work in the patient. So we have to try to eliminate those. And even more important, since the patient will be getting much more older in the future, we also have to try to develop implants which do not only last for 20 or 30 years, but maybe for 40 or 50 years. And this is still a major challenge also in the Lifelong Joint project.